Hello, this is the second video I promised to all the people who were watching the first video about the addiction series on addiction in the brain and the psychological aspects of addiction, which we're getting into now, which have to do with acceptance commitment therapy. Now, if I can harken back to the first video, what we said is that addiction is a chronic disorder that has to do with limbic structures of the brain. You have to have a certain genetic predisposition to develop addiction, and people who have addiction basically don't want to be addicted. It's something that happens to them, and then once it happens, it's very difficult for them to deal with it by and large because, first of all, they don't understand what's happening to themselves, and then second of all, these are deep-seated limbic structures in the brain that cause people to persist in their behaviors despite the fact that they don't want to continue to do those behaviors. So let's get on with this now. Acceptance commitment therapy is not something that I thought up. This is something that Stephen Hayes and Russ Harris came up with, and they've become very famous with it, and I give them full credit for what I'm about to tell you. Now, what I found though is that acceptance commitment therapy is extremely valuable for treating people with addiction and chronic pain and just addiction in and of itself. What I want you to understand is that almost everybody that I see that has addiction is basically either traumatized or suffering from high expectations. When I'm saying high expectations, in other words, either their parents, their family, or themselves have set the bar up to here. They make it to here. Now, this is all in their mind, of course. And instead of looking at all the wonderful things that they've done in their life, all they look at is the things that they missed out. So that's the expectations part. Now, the trauma part is fairly self-evident. We have lots of people who have been sexually abused as children. We have a lot of veterans who went to Iraq and got hit by IEDs or saw a lot of trauma, a lot of mayhem, and those sorts of things. We have people who basically have been traumatized just in day-to-day type life, in motor vehicle accidents, those sorts of things. Trauma is trauma. And basically it affects the brain, as we talked about in the last video, where the amygdala is actually changed. And what happens to people is that the trauma stays with them and begins to cause all sorts of psychological problems. Now, especially for children, if you're a child and you suffered trauma, the way you interpret that is that it's your fault. Now, that doesn't have anything to do with reality, but the way you process it is that you feel like somehow it was your fault that the trauma occurred, or that you should have done something about it. Or if you were, say, a child in a family where you saw other people traumatized in the family, you felt like perhaps you should have done something or whatever. Again, you were probably powerless to do anything, but you retained the shame and guilt. For people who were Holocaust survivors, for instance, the people that actually survived have survivor's guilt because why did I survive where other people perished, etc. So anyway, so between trauma and high expectations, what happens to people is they invalidate themselves. And when they invalidate themselves and feel the guilt and shame that we just talked about, if you ever watch Brene Brown or any of her videos, which I would highly recommend, she talks about shame shields. And shame shields can take one of three forms. One is that you can become angry or violent. Another shame shield is that you can basically become sort of codependent and kind of go along to get along. Or the third shame shield is you can isolate. And almost all the patients that I see are incorporating one or more of those shame shields to basically deal with all of this early trauma, all of this self-invalidation, all of this unmet high expectations, either for themselves or by other people. Now, when you are incorporating all these things, what it leads to is all these negative emotions like depression, anxiety, and again, I don't want you to get the impression that I'm saying that all depression and all anxiety comes from this. I'm just saying that there's plenty of depression and anxiety to go around that was caused by these sorts of feelings. Emptiness, loneliness, fear, you name the negative emotion, and it can emanate out of this. Now, what happens is that these emotions are too terrible for people to face, and so the natural tendency is to escape those emotions. And there's 3 different escape mechanisms, and again, I go back to Brene Brown. She talks about basically you can numb yourself. You can numb yourself with drugs, alcohol, sex, gambling, eating disordered behavior, cutting, all these sorts of things. They're all ways to basically take yourself out of this emotional morass that you're in. And so that's one way of escaping. Another way of escaping is to escape into perfectionism. A lot of people who, for instance, either might be OCD, they might just be perfectionists at their job, all these sorts of things. Perfectionism is a way to escape your feelings. Now, the problem with perfectionism is that nobody's perfect, and so you're basically always pushing a rock up a hill only to watch it roll back down. Yeah, another escape mechanism is catastrophic thinking. Catastrophic thinking is just waiting for the other shoe to drop. In other words, many people can be having what everybody else would say is a very good day, but they can't have a good day because even if they're having a good day, they're waiting for something bad to happen. And that, again, is another escape mechanism. So whether you numb yourself, which is what I deal with mostly in my practice, or perfectionism, and I deal with a lot of that, or catastrophic thinking, and I deal with a lot of that, you're going to suffer. And then the suffering basically re-traumatizes you. And then you're back into this whole cycle of escape, suffering, etc. Okay? So for all the patients that I see, basically they're caught up over here on this left-hand side of the board. Our job, and the whole idea behind acceptance and commitment therapy, is to move people to this right-hand side of the board. Now, one of the things that I do with everybody that comes into my office, I always have 3 chairs in my office, and I'm not going to reproduce that here in my little office here. But imagine 3 chairs. And so my name's Joe, so I'll have Joe be the patient. So we'll say, Joe number 1, we want you to talk to Joe number 2, that's an empty chair. And we'll say, Joe number 1, tell Joe number 2 all the terrible things you tell yourself about yourself. And people have no trouble at all going to this. They always say, I feel worthless, I'm a terrible father, I'm a terrible son, I'm a terrible this, I'm a terrible that, I've screwed up my life, I've ruined my educational opportunities, I've gone to jail, etc., etc. Okay, they can go on like this for a really long time. So anyway, we go through that. So then I'll stop them, and then I'll put them in chair number 2. And I'll say, okay, now, Joe number 2, I want you to defend yourself to Joe number 1. And they usually can do that very easily as well. They'll actually change voices and kind of perk up, and they'll say, well, you know, I really didn't want to have this addiction problem, or I didn't really want to have the problems that I have if I hadn't come from the family that I came from, etc., etc., etc. And again, they can go on for 5, 10, 15 minutes defending themselves, no problem. So then I take Joe and I put him in chair number 3, and I'll say, Joe number 3, what I want you to do is speak some compassion to Joe number 1 and Joe number 2. And I'll get one of 2 responses. The first response will be complete silence. They don't know what to say to themselves. Or the second response that I typically get is they'll start to lecture Joe number 1 and Joe number 2. Well, Joe, you know, if you would just do this, and you know, you can do this, and et cetera, and they can go through all these machinations. And basically what they're doing is sounding like their parents or somebody that's an authority figure. So I stop them and I say, Okay, now, Joe number 3, here's what I want you to say to Joe number 1 and Joe number 2. Joe, you're smart, you're handsome, you're important, you matter. They do that, and basically there's a transformation that takes place. And what I tell them is that Joe number 1 and Joe number 2 is their addiction. Joe number 3 is the Joe that everybody wanted back as the old Joe, whatever, if that makes sense. So we have to start people off with beginning to get them to sit in chair number 3 and validate themselves. Have some self-compassion, which is very difficult for people. You would think that would be the easiest thing in the world, but people are so hard on themselves. And begin to take care of themselves rather than to take care of everybody else or to get all caught up in all of this stuff here on this left-hand side of the board. If they can do that, then we try to move them to accepting their feelings rather than escaping their feelings. And Russ Harris put a little 5-minute video together, which I would direct everyone who's watching this to if you're interested. It's called Demons on the Boat. It's a little YouTube video. And what it is, it's a little guy, it's a cartoon. This little guy is trying to sail his boat to shore. And every time he grabs the wheel, sets sail, sets course, and he starts off towards shore, all these demons come up out of the hull of the ship and start screaming at him. And it frightens him, and he lets go of the wheel, and so then his boat starts to go around in circles. Now, when the boat starts to go around in circles and he lets go of the wheel, the demons go back below deck. So he's either trying to go where he wants to go with the demons screaming at him, or he's going around in circles, bored, tired, lonely, having negative feelings about himself. Now he sees other boats going where they want to go, so it kind of ticks him off. Finally, it dawns on him after many attempts to grab the wheel that the demons actually can't hurt him. And so he has this revelation that he can grab the wheel, and on cue, the demons do come out and start screaming at him, and they're frightening, but he actually sails his boat to shore. Now, that might sound like a really silly analogy, but everybody that I deal with in my practice basically is dealing with their demons. And the demons can be all kinds of different things. It can be past trauma, it can be their anxiety, it can be anger, it can be all kinds of negative sorts of things. But what we have to get people to understand is that those emotions actually can't hurt them. And they are in the past, the events that at least triggered the emotions. So if we can get people to accept feelings rather than escape feelings, then we can get people to begin to move towards what we would say is a values-driven life. And everybody has values, and we don't really care what their values are as long as they're healthy values. We don't want people to value getting high, for instance, but if they're valuing their family, their job, relationships, all these sorts of things, then what we want to do is help give them ideas about how to live the values-driven life. And if they do that, then they'll be happy and content. And all of this stuff on the left-hand side of the board will be a thing of the past. Now, I don't know if anybody is familiar with The Lion King, the movie. I'm sure most of you saw it when you were younger and that sort of thing. But The Lion King is actually acceptance commitment therapy in a nutshell. A lot of people say, well, The Lion King is Hamlet. And I'm not saying that it's not Hamlet too, but the deal is if you look at it, little Simba was supposed to become the Lion King, so the expectations were high. Little Simba also was a little bit mischievous, and he got himself in certain situations, but Scar, his evil uncle, wanted to get rid of him and Simba's father, Mufasa. So Scar sets up the stampede with the hyenas, and then the hyenas stampede the wildebeest. Little Simba's out in the middle of nowhere with the wildebeest coming at him. He panics. He's about to get trampled. His father gets wind of the stampede. Mufasa comes down, grabs little Simba, throws him out of the way. Mufasa's trampled but not killed. But at this point, Simba doesn't know what's going on. Mufasa comes up out of the cavern. Scar's up at the top. Scar betrays Mufasa, throws him off the cliff, and kills him. Little Simba comes along and finds his father dead. And little Simba, first of all, is mortified because his father is now dead. But he also feels shame and guilt because he believes that at some level he was responsible for his father's death, which was not true. The whole thing was obviously a setup. Simba comes up out of the cliff, and Scar basically guilts him. And instead of throwing him off the cliff, which would have been a quick end to the movie, he basically says, well, you know, if you hadn't been down there where you weren't supposed to be, the stampede wouldn't have caused your father to come, etc., so your father wouldn't be dead. Well, anyway, so now Simba's not only mortified by his father's death, he's guilt-ridden, and now he's shamed by his uncle. So Simba runs away. He makes it to another part of the jungle, and he meets Timon and Pumbaa, and they do Hakuna Matata. Now, Hakuna Matata in the movie looks like having burping contests and eating bugs. But I'm telling you, from a standpoint of acceptance commitment therapy, all of that behavior was basically Simba escaping his feelings because he couldn't stand the idea of him being responsible for his father's death. So he grows up doing Hakuna Matata and is kind of lonely, isolated, ultimately, and is just sort of out there. He grows up to be a mature lion, and he looks in the pond or the water, and he sees his reflection, which looks like his father. And his father speaks to him from the sky and says, "Simba, you have forgotten who you are." And his father wants him to go back and reclaim his rightful place. But what does Simba do? Simba sits in chair number 1. He says, "No, I'm not worthy. I'm terrible. I'm a terrible lion. I killed my father. I can't go back." So that's Simba number 1. So then Simba's girlfriend comes along, Nala, and she says, "You know, you've got to come back. We're all just starving to death. Scar's ruined everything. The hyenas are eating all the food, etc." What does Simba do then? Does he go back? No, he sits in chair number 2. He says, "Well, look, I'm going to be all right. You guys will be all right, but I'm not going back." So he defends himself and does not go back. Then Rafiki, the shaman monkey, comes along, and he basically tries to get Simba to see the light and come back. And Simba's not having it. And so they're having a good conversation, and Simba just takes his stick. Rafiki takes his stick and just whacks Simba in the head. Out of the blue. It wasn't out of anger. He just hits him in the head. And Simba goes, "What'd you do that for?" And Rafiki, this is the whole movie, Rafiki says, "Don't worry about it. It's in the past." And then Rafiki takes his stick and swings at Simba again. And Simba ducks this time. And Rafiki goes, he says, "You can either run from the past or learn from the past." The light bulb goes off in Simba's head. He sits in chair number 3, basically goes back. He kicks all the hyenas around, he kills Scar, and he becomes the Lion King. Basically, that's acceptance commitment therapy in a nutshell. So what I want you to understand is that we're trying to get everyone that we take care of from the left-hand side of the board to the right-hand side of the board. This is possible, and this is what people need to do if they're going to find healing and wholeness. So thank you very much.